Most men think prostate cancer shows obvious symptoms, but here's the truth. You might not feel a thing until it's already advanced. That's why prostate cancer is often called a silent disease. Waiting until you notice changes like frequent urination or pain can be too late. But the good news is this: we have simple, effective tests that can detect problems years earlier. The PSA blood test is quick, just one tube of blood. Yet it can signal hidden changes. A short physical exam, the digital rectal exam, sometimes finds what blood tests miss. And when needed, MRI imaging gives a detailed look inside the prostate. Think of these like a smoke detector for your health. You don't wait until the fire spreads, you check early to protect yourself. So if you're over 50 or have a family history, talk to your doctor about screening. A simple test today could mean decades more with the people you love. Hi, I'm Dr. Gunter, a urologist with over 25 years helping men over 50 protect their prostate health. I've seen too many patients who thought they were fine until a routine test revealed something far more serious. And catching it early changed everything. What most people don't realize is that prostate cancer often develops silently, without pain or obvious warning. That's why proactive screening isn't just about preventing cancer. It's about preserving your vitality, your independence, and your future with the people you love. The decisions you make today determine the decades ahead, so don't wait for symptoms. Start the conversation with your doctor, share this with a loved one, and subscribe for more weekly insights on men's health. A single step now could truly save a life. Your prostate isn't just about urination. It's connected to your hormones, your fertility, even your cardiovascular health. In other words, the prostate is like a window into how well your entire body is aging. When it functions smoothly, it often means your hormones are balanced, your blood vessels are healthy, and your energy stays steady. But when problems appear, whether it's a rise in PSA levels, changes in texture on an exam, or simply subtle shifts you might not even feel, those are signals that something deeper could be happening. I've met men who thought prostate health was only about avoiding inconvenience at night, waking up fewer times to use the bathroom. But in reality, those small changes were early clues to bigger issues: declining testosterone, hidden inflammation, even early cardiovascular strain. One patient once told me, "Doctor, I thought my prostate was just about getting older. I didn't realize it was my body trying to get my attention." And that's the key. Prostate screening isn't only about detecting cancer. It's about catching the whispers of your body before they turn into shouts. It's about choosing prevention over crisis. Every test, whether it's PSA, a quick exam, or an MRI, is a chance to step in early, to extend not just your lifespan, but your health span. So when you think about screening, don't picture a hospital or a diagnosis. Picture being able to travel with your partner, play with your grandchildren, or simply wake up every day feeling strong. That's the real promise of early detection, because caring for your prostate is caring for your whole self, your dignity, your independence, and the years of life still ahead. Step 1. PSA Blood Test. The very first step in understanding your prostate health is the PSA blood test. It sounds technical, but in reality, it's one of the simplest things you can do, just a small blood draw, usually during a routine checkup. PSA stands for prostate-specific antigen, a protein produced by both normal and abnormal prostate cells. Every man has PSA in his blood, but the level can rise when the prostate is under stress. Here's the important part: higher PSA does not always mean cancer. It could be inflammation known as prostatitis. It could be benign prostatic hyperplasia, a common non-cancerous enlargement of the prostate that comes with age. Or yes, it could be an early sign of prostate cancer. That's why PSA isn't about giving you a final answer. It's about giving you an early warning, a signal that says, pay attention. Think of PSA as your prostate smoke alarm. Most of the time there's no fire. Maybe it's just smoke from cooking. But sometimes it really does mean danger, and without that alarm, you'd never know until the flames were out of control. I remember a patient, Mark, who came in at 56 for his annual physical. He felt perfectly healthy, exercised 3 times a week, and had no urinary problems at all. His doctor suggested adding a PSA test just as part of routine screening. The result, a slightly elevated level. At first, Mark thought it was a fluke, but we followed up, and after further imaging and biopsy, we discovered an early-stage cancer, something he never would have felt on his own. Today, Mark is cancer-free, he told me. That little blood test saved my life. I didn't even feel sick. That's the power of PSA. It's not about fear, it's about foresight. It allows you and your doctor to start a conversation. If levels are normal, it's reassurance. If they are elevated, it's not panic, it's a chance to dig deeper, to use more specific tests like free VS, total PSA, MRI, or biopsy. And here's where the science inspires hope. Studies show that men who undergo PSA screening are more likely to have their cancer detected at an early treatable stage. Early detection means more options, less invasive treatment, and better quality of life. Instead of facing aggressive therapies later, many men can choose targeted treatments or sometimes just careful monitoring. But beyond statistics, here's the human truth. PSA testing gives men the power to act, to make choices before illness makes them for you. It's about owning your health, about refusing to let silence dictate your future. For families, it's a gift. Imagine your children or grandchildren knowing that you took the step to stay ahead, that you chose prevention over uncertainty. That blood test becomes more than numbers on a chart. It becomes years of birthdays, family dinners, road trips, and laughter that might otherwise have been stolen. So when you hear PSA test, you don't think of a scary medical procedure. Think of it as one of the easiest, most accessible tools modern medicine has to offer. 5 minutes of your time, one small tube of blood, and potentially a lifetime of difference. Remember, the prostate doesn't shout when it's in trouble, it whispers. And the PSA test is how we listen. So ask yourself, isn't it worth one simple test to protect everything you've worked for, everyone you love, and the life you still want to live? Because in the end, prostate cancer isn't just about disease. It's about dignity, independence, and time. And time is the most precious thing any of us have. Step 2, free VS, total PSA. If the PSA blood test is your prostate smoke alarm, then the free VS, total PSA test is the way we check what's really causing the smoke. It adds nuance, clarity, and context, because not all PSA is the same. Here's how it works. PSA in your blood exists in 2 forms. Some of it floats freely. This is called free PSA. The rest is bound to proteins in your blood. This is called complexed or bound PSA. When we talk about total PSA, we mean both combined. The important clue is the ratio. What percentage of your PSA is free versus bound? Why does this matter? Research has shown that men with prostate cancer tend to have a lower percentage of free PSA. In other words, when the free PSA is low, the likelihood of cancer is higher. Conversely, when the free PSA is relatively higher, it often points to benign causes like inflammation or age-related enlargement. Think of it like this. Imagine you hear a smoke alarm in your house. You walk in and smell smoke, but where is it coming from? Is it burnt toast in the kitchen, or is it an actual fire in the living room? The free to total PSA ratio is like opening the doors and windows, looking around, and figuring out what's really going on. It helps doctors decide whether you need further testing or whether you can simply watch and wait. I recall a patient, Thomas, 61, who came to me after his routine PSA came back slightly elevated. He was anxious, imagining the worst. We did a free VS total PSA test, and the ratio was reassuring, more than 25% free PSA, which suggested a benign condition rather than cancer. Instead of rushing him into a biopsy, we monitored closely. A year later, his numbers stayed stable and his anxiety lifted. He once told me, "Doctor, knowing the details saved me from unnecessary worry. I could focus on living, not fearing." On the other hand, I've seen cases where the free PSA was strikingly low, under 10%. Those men often turned out to have early-stage cancers, even when their total PSA didn't seem alarmingly high. Because we dug deeper, we caught it early, when treatments were most effective and outcomes most hopeful. That's the true power of this test. It doesn't just give numbers, it gives context. And context is what separates fear from clarity, panic from purpose. Science tells us that combining total PSA with the free-to-total ratio reduces unnecessary biopsies, spares men from invasive procedures, and ensures we only act when action is truly needed. It's not about testing for the sake of testing. It's about being smarter, more precise, and more compassionate in care. And here's where the inspiration comes in. Medicine is not just about machines or numbers. It's about giving people back their peace of mind. For every man who hears elevated PSA and feels his stomach drop, the free VS total PSA test can be the difference between sleepless nights and a steady breath of relief. When I explain this to patients, I often say, this test doesn't just measure blood, it measures certainty. Because sometimes the best medicine isn't just catching disease, it's preventing unnecessary fear. So if you or someone you love has an elevated PSA, remember, don't stop at the alarm. Ask for clarity. Ask for the free VS, total PSA ratio. It might confirm the need for further testing, or it might spare you from unnecessary procedures. Either way, it gives you power, the power of knowing. Because the goal of prostate screening isn't just early detection, it's also smart detection. It's about balancing vigilance with wisdom, science with humanity, and free VS. Total PSA is one of the simplest tools we have to strike that balance. At the end of the day, what matters most isn't just living longer, but living with confidence, free from the shadow of uncertainty. That's what this test can offer: a clearer picture, a steadier path forward, and the reassurance that you are not left guessing about your own health. Step 3. Digital Rectal Exam (DRE). If the PSA blood test is the smoke alarm and the free VS, total PSA ratio is the investigation, then the digital rectal exam or DRE is like stepping into the room with a flashlight. It's direct, it's simple, and sometimes it finds what all the numbers miss. Here's what it is. A doctor gently inserts a gloved, lubricated finger into the rectum to feel the prostate, which sits just in front. It takes less than 10 seconds. Through touch, the doctor can assess the prostate's size, shape, and texture. They can detect hard spots, nodules, or irregularities that might suggest cancer. Now, let's be honest, many men cringe at the thought. The idea of the exam feels uncomfortable, even embarrassing. But here's the truth: the discomfort lasts seconds. The peace of mind lasts years. I'll never forget a patient named Jim, 62 years old. His PSA was normal. No alarm bells. But during a routine DRE, I felt a firm nodule on one side of his prostate. We followed up with imaging and biopsy, and yes, it was cancer. Caught early, treated successfully. Jim later told me, "Doctor, I was more scared of the exam than the disease. Now I'm alive because you didn't skip it." That's why DRE still matters, even in the age of advanced imaging. Numbers can sometimes mislead. PSA can rise for reasons unrelated to cancer, and sometimes cancer hides even when PSA is normal. But the human hand, trained and experienced, can sense changes no blood test can reveal. Think of it this way: PSA is like checking your car's warning lights. They tell you something might be wrong, but a mechanic still needs to lift the hood to feel, to look directly. That's what the DRE does. It's the hands-on check that grounds all the data in real, physical evidence. Scientifically, studies have shown that combining PSA testing with DRE increases the likelihood of detecting prostate cancer early. It's not either slash or, it's both together, forming a stronger safety net. And while some guidelines debate its use, countless stories like Jim's prove that sometimes the old-fashioned, human-centered approach saves lives. Here's the inspirational part: courage isn't the absence of discomfort. Courage is choosing a few seconds of discomfort today to gain years of health tomorrow. Too many men avoid the DRE out of fear or embarrassment, but the truth is the test is quick, private, and far less invasive than the treatments you might need if cancer is found late. One of my patients once said, "I thought the DRE would take away my dignity. In reality, it gave it back because now I have control over my health." That's the heart of screening: not robbing dignity, but protecting it. So if you're over 50 or younger with family risk, don't shy away from the conversation. Ask your doctor about the DRE. Remind yourself 10 seconds. That's all it takes. 10 seconds to check. 10 seconds to listen to your body in a way blood alone can't. Because early detection is never just about survival. It's about preserving your independence, your relationships, your future plans. It's about ensuring that the years ahead are lived fully, not defined by illness that could have been caught sooner. So the next time someone jokes about avoiding the DRE, remember Jim. Remember the countless men who walked into a room thinking they were fine and walked out with a second chance at life. And remind yourself, your courage today can buy you tomorrow. Step 4. MRI Imaging. If the PSA test is the smoke alarm and the DRE is the flashlight, then MRI imaging is like turning on the floodlights. Suddenly the whole room comes into focus. No guessing, no squinting, no shadows hiding in the corners. Just a clear picture of what's really happening inside the prostate. So what is an MRI? MRI stands for magnetic resonance imaging. Unlike X-rays or CT scans, it doesn't use radiation. Instead, it uses powerful magnets and radio waves to create incredibly detailed images of the prostate. In particular, we use what's called a multiparametric MRI, a type of scan that looks not just at the anatomy, but also at the blood flow and tissue characteristics inside the gland. This makes it especially useful for spotting suspicious areas that might represent cancer. Why does this matter? Because not every elevated PSA or abnormal DRE means cancer, and not every cancer is dangerous. MRI helps us distinguish the needle in the haystack cancers, the ones that truly need treatment, from those that can simply be monitored. I remember a patient named Daniel, 58. His PSA had been creeping upward over a few years, and his free PSA ratio suggested something might be wrong. He was nervous, worried about an immediate biopsy. Instead, we ordered an MRI. The scan showed a small, well-defined lesion, nothing widespread, nothing advanced. That clarity allowed us to target his biopsy precisely, confirming the diagnosis at a very early stage. Today, Daniel often says that MRI gave me peace. It took away the mystery. On the other hand, I've had patients whose MRI came back completely clean even after an elevated PSA. In those cases, we could avoid unnecessary biopsies and simply keep monitoring. That's the double gift of MRI. It catches what's real and filters out what's not. Think of MRI like Google Maps for the prostate. Instead of wandering blind, it shows us the roads, the detours, even the traffic jams. It tells us exactly where to look, where to act, and sometimes where not to worry. The science is powerful. Studies show that adding MRI to prostate cancer screening reduces unnecessary biopsies by up to 1/3, while also improving the chances of finding clinically significant cancers. That means fewer men go through painful procedures they don't need, and more men catch dangerous cancers before they spread. But beyond the data, MRI represents something deeper: clarity. For many men, the scariest part of prostate cancer isn't the disease itself, it's the uncertainty. Do I have it? Do I not? What if I wait too long? What if I act too soon? MRI helps replace those questions with answers, and answers bring peace. Yes, it takes more time than a blood test. Yes, it may cost more. But imagine trading a single scan for years of knowing exactly where you stand. Imagine lifting the fog of doubt and stepping into a future where decisions are guided by precision, not fear. One patient once told me after his MRI, "Doctor, I finally feel like I can breathe again, not because everything was perfect, but because I finally knew the truth." And that's the gift of this technology. It's not just pictures, it's perspective. It empowers men to move forward, whether that means treatment, monitoring, or simply reassurance. So when you think of prostate cancer screening, don't picture endless tests and needles. Picture a roadmap, picture clarity, picture the freedom of making informed choices about your health. That's what MRI delivers, not just images, but insight. Because at the end of the day, knowledge is what keeps fear small and hope large. And with MRI, knowledge has never been clearer. Step 5, biopsy when necessary. If PSA is the alarm, free vs. Total PSA the investigation, DRE the flashlight, and MRI the roadmap, then biopsy is the moment we finally lift the hood and look directly at the engine. It's the test that turns suspicion into certainty. So what is a biopsy? Prostate biopsy involves taking small samples of tissue from the gland, usually guided by ultrasound or increasingly by MRI. These samples are then examined under a microscope by a pathologist. Unlike every other test, biopsy doesn't suggest, it confirms. It tells us with certainty whether cancer is present, how aggressive it is, and what treatment, if any, is needed. For many men, the word biopsy sparks fear. They imagine pain, risk, or a guaranteed cancer diagnosis. But here's the truth: not every elevated PSA or MRI finding requires a biopsy. Doctors recommend it only when the risk is significant enough that knowing for sure will change your care. In other words, biopsy is used with purpose, not by default. I remember a patient named Harold, 65. His PSA was moderately elevated, and his MRI showed a suspicious area. He was terrified of the word biopsy. After a long conversation, he agreed to move forward. The results revealed a low-grade, slow-growing cancer, the kind we could safely monitor with active surveillance instead of rushing into surgery. Harold later told me, "Doctor, I dreaded the biopsy, but it turned out to be the test that gave me freedom. Now I know what I'm dealing with, and that knowledge took away the unknown." On the other hand, I've seen men like Peter, 59, whose biopsy uncovered an aggressive cancer that neither PSA nor DRE had fully revealed. Because we caught it when we did, treatment was swift and effective. Today, Peter is back to hiking with his wife, grateful that he faced the test instead of ignoring it. Here's the science. Modern prostate biopsies are safer and more precise than ever. Techniques like MRI fusion biopsy allow doctors to target only the areas of concern, reducing unnecessary sampling and improving accuracy. Complications are rare, and most men return home the same day. Think of biopsy as the final piece of the puzzle. Without it, you're staring at a blurry picture, wondering if the shadows mean something dangerous. With it, the picture comes into sharp focus. You can make decisions with clarity, not guesswork. Yes, it's not as simple as a blood draw. Yes, it carries some discomfort. But ask yourself, isn't a moment of discomfort worth years of certainty? Isn't the temporary unease worth the chance to protect your future? Because here's the bigger truth: biopsy is not just about finding cancer. It's about characterizing it. Not all cancers are equal. Some grow so slowly they may never impact your life. Others are aggressive and demand immediate treatment. The biopsy gives us that roadmap, showing whether you can safely watch and wait or whether you need to act now. I often tell my patients, biopsy doesn't just find disease, it helps us protect your dignity, your independence, and your future choices. Because nothing robs dignity faster than uncertainty. One man summed it up best after his biopsy: it wasn't easy. But now I have answers, and answers are better than fear. So if your doctor recommends a biopsy, remember this: it's not a sentence, it's a safeguard. It's not punishment, it's protection. It's the final step in a chain of tools designed not to scare you, but to save you. Because in the story of prostate health, biopsy is not the end. It's the beginning of clarity, of informed choices, and of hope. Take Robert, 59. By all accounts, he was the picture of health. He jogged 3 mornings a week, kept up with his grandkids, and never once thought about his prostate. He had no symptoms, no pain, no urinary problems, no warning signs at all. To him, prostate cancer was something that happened to other men, not him. But during his annual physical, his doctor suggested adding a PSA test. Just routine, the doctor said. The result came back mildly elevated. Nothing dramatic. Nothing alarming, but just enough to raise a red flag. Robert almost dismissed it, thinking maybe I exercised too hard that week. But instead of ignoring it, he followed through. The next step was an MRI, which revealed a small but suspicious area. A biopsy confirmed what Robert never imagined: prostate cancer. The good news: it was early stage, confined, and highly treatable. Robert went through treatment, supported by his family. Within months, he was back on his feet. Today, he's cancer-free. On Saturdays, you'll find him out on the golf course with his friends, laughing louder than ever, grateful for every swing of the club. When I asked him what he learned, he said, "Doctor, I thought screening was unnecessary because I felt fine. Now I realize feeling fine doesn't always mean being fine. That little blood test gave me years of life I might not have had." Robert's story is a reminder: prostate cancer doesn't always announce itself. It whispers. Screening is how we listen. And sometimes that simple choice, a routine test, a short exam, a follow-up scan, becomes the reason a man lives to enjoy decades more of ordinary, extraordinary life. So here's what to remember. PSA Blood Test, the smoke alarm that tells us something might be off. Free vs. Total PSA, the investigation that brings clarity. Rectal Exam, the quick hands-on check that sometimes finds what numbers miss. MRI Imaging, the roadmap that shows us the bigger picture. Biopsy, if needed, the final step that turns suspicion into certainty. These aren't just medical tests. They're your early warning system. They're how we listen when your body whispers long before it ever has to shout. And that's when prostate cancer is most treatable, when you don't even feel sick yet. But beyond the science, here's the deeper truth. These steps are not about disease. They are about life. They're about the golf games you still want to play, the trips you still want to take, the grandchildren you still want to hold. They're about protecting the dignity, independence, and joy that make life worth living. I've seen too many men who thought screening wasn't necessary until it was too late. And I've seen men like Robert who caught it early and went on to live fully, freely, and gratefully. The difference wasn't luck, it was choice. So if this message helped you, don't keep it to yourself. Share it with your father, your brother, or your friend. You might just change or even save their life. And if you want to keep learning how to take charge of your health, subscribe so you never miss my weekly updates on men's health. Because knowledge is power, and in this case, knowledge is time. And time is the most precious thing we have.